All right. Well, hello and welcome to ALCA's Aging Life Care Moment. As part of our efforts around diversity and inclusion, we are talking to members to hear about how they got started in their aging life care practice, but also diversity issues within ALCA and the care management industry. Today, we are talking with Abbe Udochi, founder and principal of Concierge Healthcare Consulting and a member of ALCA's Diversity and Inclusion Committee. Abbe, welcome. Tell us how you got started in this business and how long you've been practicing care management.
Sure. Well, Courtney, thanks for inviting me to do this. It really is a pleasure to talk with you about these issues today. I launched my practice in 2018 after a decade, 2 decades long career in the managed care space in New York State, which is where my practice is based. And I did all kinds of things. I held several senior vice president roles from in operations, marketing, customer service, and lobbying and advocacy. So once I left that industry and wanted to kind of scratch the itch of entrepreneurship, becoming or opening, launching a care management practice was really an obvious choice for me because care management is something that is near and dear to many of us who are in this industry and doing this work. Like many of my fellow GCMs, I have personal experiences in care management. My first one was really before I took the job in managed care. I had an uncle who came down with pancreatic cancer. He was getting care at one of the largest and most well-known cancer centers in this state. And it was difficult for him as an older man of color to navigate that system. And I shared care management responsibilities for my mom. He ultimately passed from pancreatic cancer, but this happened right before I took the job in managed care. So it really sensitized me to how difficult it is to be low income and sick anywhere in the United States, but in particular in a large metropolitan area. And helping him through that is part of what inspired me to launch this practice.
That is inspiring. I think a lot of members talk about that, the personal experience that really compels them into ultimately their career in aging life care management. In terms of ALCA and the Aging Life Care Association, when did you join ALCA? Was it shortly after starting your business? And tell us, how you've been involved with ALCA since joining.
ALCA has been wonderful. I joined just this year in April, so my tenure isn't very long, but I have jumped in with both feet because I joined right at the top of the pandemic. And I was encouraged by another ALCA member, 2 other ALCA members to join because I was told that ALCA was providing a lot of support to care managers around the country in how we deal with this unprecedented, once in a generation, hopefully, kind of an outbreak. And that's exactly what I found here. So these last few months in ALCA, I've had the opportunity to really spread my wings. In addition to all of the learning opportunities that ALCA provides, I've joined the diversity task force with ALCA National, the diversity committee with my state chapter, but also I've been able to join the National Public Policy Committee and be involved in those really important conversations. Now that we have a new administration coming in next year, we'll have the opportunity as an association to really put forward the kind of assistance that GCMs provide to the elderly population in this country and how important the work that we do is. And so really kind of ringing that bell very loudly and encouraging people to understand what GCMs do through the Public Policy Committee, I'm really looking forward to.
That's so inspiring to hear, just how actively you got involved, from the beginning. And I think that's a great message for other new members. It's just that this association really is very active in helping others, around the country. You're on the.
Can I jump in and just respond to that also, Courtney? I think you're right. ALCA is wanting to encourage GCMs to be involved, not only in ALCA, but in their local chapters and where they are in their municipalities as well. I also had the opportunity to be tapped to join Governor Cuomo's administrative simplification in healthcare task force in New York State, and that's a mouthful, but it's an opportunity to represent geriatric care managers and others who are really interested in consumers having an easier time when they engage in healthcare in this state.
Hmm. Yeah, absolutely. I agree with you. I mean, focusing on kind of all this public policy and diversity. I mean, this 2020 year has really put a spotlight on those two areas and all the problems, that we still have to overcome in terms of, getting access for people and then the diversity issues. With your roles on, the local chapter and national for the Diversity and Inclusion Committee, I'd love to hear what you think that ALCA can do, or just the industry and wide, since you're looking at, advocacy and public policy to help increase diversity and just help show that this is a viable career option for all kinds of people who are interested in aging life care management.
Yes, so that's a really great question, Courtney. It is, healthcare in general is one of the fastest growing and largest industries in this country. And given where we are right now, we're in the midst of a pandemic that is unlike any other in at least a century, potentially more when all is said and done. So having people of color, African Americans, Latinx, Asian, Indian involved in not only care, but policy that helps determine how care gets delivered, where it gets delivered, who is able to access it, and when, is so important. So having people of color who are qualified in those areas to be in these discussions, to sit at these really important tables, is critical as we move forward and make decisions that will shape the future of care and how care gets delivered in this country. And I think ALCA members, GCMs around the country have a real opportunity to be seized, to allow our voices to be heard and really advocate for the people that we care for, seniors and those who love them.
Thank you so much for that, and just acknowledging, your phone rang, and it's just another indication of, that you're a busy professional, you own your business. And, I just so appreciate you taking the time for this interview, for all the work you're doing for the industry, for care management, and for ALCA, and for diversity efforts on all of those areas. So thank you so much, Abbe, for your time this day, and thank you again.
My pleasure. Thank you, Courtney.